Good morning, this is George Block. I'm at the American Swimming Coaches Association World Clinic in Washington, D.C. I'm here with Dr. Laura Cox. Dr. Cox has been the ASCA's anti-doping expert for the past 25 years. When she first brought it to our attention, we thought what she was telling us was science fiction, and now we found out the truth is even worse than fiction. But Laura has also given us hope and showed us that it's possible to really do something. Laura, in the past 2 decades, any high-profile athlete that's been caught hasn't been caught through testing. They've been really caught through investigative methods. What can we do that testing is credible to athletes and will protect clean athletes?
So the answer is actually pretty simple, is to take advantage of current technologies for the testing. There are technologies available now that 25 years ago seemed like science fiction, that are incredibly sensitive, extremely reliable, and for some reason they're not being used by the current anti-doping agencies. Many of these, the big technologies like mass spectrometry and high throughput sequencing are being used in the clinic to diagnose disease, metabolic disorders, and things like that. So these are not just like out there in the future basic research technologies that may or may not be proven. These are well-proven technologies. So that's the first step, is bringing those online to use. And then the next step is collecting normative data. So what is a normal profile for an elite athlete? And does it differ for men and women? Does it differ in swimming and track and field? And so we have to know the landscape of what does the normal signature look like to then be able to use that as a framework to identify things that differ from what's normal.
So the current technology is high throughput testing with multi-dimensional screening.
Yes.
In English, what does that mean to the non-scientist?
That means that we can use technologies that can identify molecules in individuals that reflect the biology of that individual. And why is that important? Because we know that there are basic biological systems that work certain ways, and that when you dope or you do some kind of manipulation to that individual, the biology of those systems changes, and so the molecules that you can measure will also change.
So this afternoon we're having the World Swimming Association Constitutional Convention. What kind of wording do we need to put in our Constitution or into the bylaws that will keep us at a current level? Because current now wasn't current 25 years ago, and if we lock into technology today, that's not going to be current 25 years from now. How it seems that the wording sometimes in FINA or the IOC or in WADA locks into a technology that suddenly becomes obsolete, and so then designer drugs or whatever don't get caught. What do we need to do? How do we phrase things? What do we need to do that we stay on the cutting edge, but still have credible testing?
The key word is untargeted testing. And so one of the limitations of current testing is they produce a list of, here's what we're testing for, and if I'm taking a steroid but it differs by one molecule from what is being tested in targeted testing, it's not going to be detected as doping, as cheating. And so the testing needs to be untargeted so that we can identify, again, what are the normal molecules and what are the molecules that are different. And then once you've identified what's different, then you can follow up targeting those molecules to figure out what they are, to say, okay, this was a designer drug, and yeah, it differs from this drug by a side chain that is known to enhance performance, but because we know that base molecule enhances performance, then we know that that design drug also enhances performance.
So what you're describing is really, what I'm hearing anyway, is sort of a layer of testing where everyone's blood or urine goes through a certain screen, certain ones pop up, that gets more testing, maybe they even get a little more testing.
Right, because there may be some individuals that they have some molecules that differ because they're sick. Right, so all of a sudden they've got the flu, or they're on the early stages of the flu and they're being tested, and so all these inflammatory molecules are showing up. And so just because your molecules are different than all those normative data doesn't absolutely mean that you're testing, and so you need to have multiple layers, just like you say. So you say, okay, what is different in the profile that is abnormal? And then come back and say, okay, what are those abnormal molecules, and are they indicative of cheating, or are they just indicative that the individual is sick or something like that?
A year ago, Dr. Mark Libardoni brought to us visions of testing through exhaled breath, that as soon as somebody touched a wall, they could exhale into a tube, the breath could be collected, nobody would have to chase them around the deck for 2 hours, but you also wouldn't go in the warm down pool for 2 hours and rub cream on your body to hide things. And we could have instant testing for every single person in the pool. It would be state of the art, and that almost seemed like science fiction. Then a few months ago, we saw a study from Europe where they'd already done a proof of concept. And now did I see right that your lab is starting to move to breath testing?
We've been doing breath testing for the last few years in animal models related to heart disease and
Is it hard
diabetes.
to get the cows to blow in the tubes?
No.
They're well trained.
And in those studies, we can identify, in juveniles, we can identify differences in birth weight of those animals, and we can identify sex differences before puberty. And those are in breath samples.
So say that one more. You can have someone blow into a tube, and from that you can tell what their birth weight was?
We can tell that they were low birth weight or normal birth weight.
Wow.
And we're just submitting that manuscript for publication now.
If I blow into a tube, can you tell me what I'm going to weigh a year from now?
That's where we're going with it. So what we're starting now is a study with Children's Hospital of San Antonio, looking at obese children to identify children that are at the beginning of the trajectory of metabolic dysregulation, because just because a child is obese doesn't mean it's going to become diabetic.
Okay.
But the earlier you can identify those children that will become diabetic, the greater the opportunity to intervene and the less dramatic the intervention.
You're doing this all with breath.
We're doing this with breath.
It's just remarkable. So what seemed like science fiction to us a year ago is already in the preclinical stages.
Right, and there's a company in the UK that sells these masks with cartridges for the collection of the breath samples. So again, there are commercial products out there. This is not like in the lab some crazy scientist tinkering to put together some apparatus that, you know, looks like science fiction.
So this is actually a really hopeful thing that every coach and athlete should be able to see. We can have really credible drug testing. We can have it poolside. We can end the theater of chasing people around and swimming in the warm down pool and drinking whatever liquids for 2 hours. And we're right on the cusp of it, and it's already being used in labs, in clinics, in forensics, in food testing.
Yes.
That's some of the best news we've ever had in drug testing, Laura. And I hope we can move on it both with the World Swimming Association and get it accepted worldwide. Well, Swimming World Magazine, thank you for this opportunity to update the world on what's going on in drug testing.